Every minute, around 250 babies are born somewhere on Earth. It is a moment that has shaped human history for hundreds of thousands of years. But what actually happens inside a mother's body during childbirth? How does the uterus know when it is time? How does a baby navigate through the birth canal? Why is the process so inherently painful? And what incredible biological changes occur in just a matter of hours? Today, we are going to shrink down inside the human body to witness one of nature's greatest engineering achievements, from the first contraction all the way to a baby's very first breath. We will explore the biology of childbirth. We will look at how the body prepares, the stages of labor, how medical science steps in when things get complicated, and what parents can do to support a healthy pregnancy. This is the journey of how every human life makes its grand entrance. For about 40 weeks, the baby grows inside the uterus, protected by the amniotic sac and connected to the placenta through the umbilical cord. This cord is the lifeline, delivering oxygen and nutrients directly from the mother's blood. As the due date approaches, a remarkable chemical shift occurs. Both the mother and baby begin producing hormonal signals that prepare the body for labor. While scientists still don't fully understand the exact trigger that initiates labor, hormones like prostaglandins and oxytocin play major roles. But how do you know when it is actually starting? Many expectant mothers experience Braxton Hicks contractions, often referred to as false labor. These are irregular, unpredictable tightening of the uterine muscles. They do not follow a consistent pattern, typically remain mild, and often subside if the mother drinks water, rests, or changes position. Most importantly, they do not cause the cervix to dilate. True labor is a completely different story. These contractions occur at regular intervals, gradually becoming more frequent and lasting longer, usually between 30 to 90 seconds each. They persist regardless of movement. The discomfort often starts in the lower back and radiates to the front of the abdomen. These powerful, rhythmic waves tell the body it is time to open the door. Labor itself is divided into 3 stages. The first stage revolves around cervical dilation. The cervix is normally a firm, tightly closed opening at the base of the uterus. During the early phase of labor, often called the latent phase, the cervix begins to soften and thin out, a process called effacement. It slowly dilates up to 4 centimeters. This phase can last anywhere from several hours to a few days. Then comes the active phase. The uterus begins to contract with tremendous force in coordinated waves from top to bottom. Each wave pushes the baby slightly closer to the birth canal. As oxytocin strengthens the contractions and prostaglandins soften the tissue, the cervix stretches dramatically. It expands from 4 centimeters all the way to 10 centimeters. This is wide enough for the baby's head to safely pass through. Recent scientific developments have given us a closer look at this mechanism. Researchers have identified specific pressure and stretch sensors within the uterus. These sensors help coordinate the contractions perfectly, ensuring the muscle fibers work together. It is a highly synchronized biological dance, driven by feedback loops that intensify until the ultimate goal is achieved. This immense physical exertion brings up a common question. Why is childbirth so painful? The answer lies in the sheer volume of biological processes happening simultaneously. The uterus contracts with incredible strength. The cervix stretches beyond its normal limits. Pelvic tissues expand, and intense pressure is placed on the nerves within the pelvis. These signals travel rapidly through the spinal cord to the brain. But the body is not entirely defenseless. In response to this pain, it produces natural pain-relieving chemicals called endorphins. Often referred to as the body's natural opioids, endorphins help many mothers cope with the intensity of labor. Still, modern medicine offers various ways to manage the pain when natural endorphins aren't enough. Mothers might use breathing techniques, meditation, hydrotherapy, or position changes to find comfort.
On the medical side, options include systemic analgesics given intravenously to reduce pain perception, or nitrous oxide, an inhaled gas that reduces anxiety. The most well-known option is the epidural. An epidural involves injecting anesthetic near the spinal cord, numbing the lower half of the body while keeping the mother fully awake. It is highly effective, though it carries risks like a potential drop in blood pressure or limited mobility during labor. Some might opt for a spinal block for immediate, short-term relief, especially if delivery is imminent. Once the cervix is fully dilated to 10 centimeters, the mother enters the second stage of labor, expulsion. Now comes the dramatic part. The mother feels a strong urge to push, working with the contractions to move the baby down the birth canal. This descent is not a straight path. The baby actually has to rotate several times to fit through the complex geometry of the mother's pelvis. The head usually turns downward, tucking the chin to the chest, and then rotates again as it navigates the tightest spaces. Nature has provided a brilliant adaptation to make this possible. The bones of a newborn skull are not completely fused. They're separated by flexible gaps that allow the skull plates to temporarily overlap. This process, called molding, lets the baby's head compress just enough to pass through the pelvic bone. Finally, the climax of the second stage arrives. The baby's head emerges. This is quickly followed by one shoulder, then the other. Slipping free of the narrow passage, the entire baby is born within a matter of seconds. After months in the fluid-filled environment of the womb, the baby is suddenly out in the open air. For 9 months, the baby's lungs were filled with fluid and the placenta supplied oxygen. Now, everything changes in an instant. As the newborn experiences the outside world, they take their first breath. The lungs rapidly expand, the fluid clears out, and blood flow changes dramatically. A valve in the heart called the foramen ovale closes, and the circulatory system permanently switches from fetal to newborn circulation.
Within minutes, the baby is breathing entirely independently. Childbirth is not over quite yet. The mother now enters the third stage of labor, the delivery of the placenta. The uterus continues to contract, less intensely. These contractions cause the placenta to detach from the uterine wall and move down the birth canal to be expelled. Afterward, the uterus keeps shrinking, which acts like an internal tourniquet, compressing blood vessels and helping to reduce postpartum bleeding. While millions of births follow this sequence perfectly, biology is unpredictable. For some, the journey is vastly different, especially for those having twins or multiples. A multiple pregnancy carries a higher risk of complications like premature birth or fetal growth restriction. The physical toll on the mother is heavier, requiring more calories, nutrients, and frequent monitoring. When it comes time for delivery, multiples are often delivered via cesarean section, depending on the positions of the babies. Even with singletons, medical interventions are sometimes necessary. If labor stalls or poses a risk, doctors might recommend an induction. This involves using medications like synthetic oxytocin to jumpstart contractions before natural labor begins. If vaginal delivery becomes unsafe due to fetal distress or abnormal positioning, doctors perform a cesarean section, delivering the baby through an incision in the abdomen and uterus. Labor can also present serious complications. Prolonged labor occurs when the cervix simply will not dilate or the baby stops descending. Shoulder dystocia happens when the baby's head emerges, but the shoulders get stuck behind the pelvic bone, requiring immediate physical maneuvers. There can be umbilical cord complications, abnormal fetal heart rates, or excessive postpartum bleeding. In rare instances, severe issues like uterine rupture can occur. This is why having skilled healthcare professionals present is so critical. Early detection and immediate management are the keys to keeping the mother and baby safe. Because every pregnancy is entirely unique, preparation builds confidence. Research shows that healthy habits can drastically improve the chances of a safe delivery. Attending regular prenatal care appointments allows doctors to detect issues like gestational diabetes or preeclampsia early.
Staying physically active with moderate exercise like swimming or prenatal yoga can improve cardiovascular fitness and may even shorten labor. Eating a balanced diet rich in iron, calcium, folate, and protein supports fetal development, while prioritizing sleep and mental health helps manage anxiety. Mothers should avoid smoking, alcohol, and recreational drugs and be vigilant for warning signs like heavy bleeding or severe abdominal pain. Taking childbirth education classes and having a flexible birth plan can remove much of the fear surrounding the delivery room. Childbirth is one of the most extraordinary biological events on Earth. In just a few hours, the uterus contracts with immense coordinated strength. The cervix transforms. The baby navigates a complex physical maze. Lungs take their very first breath. Two bodies undergo some of the most dramatic physiological shifts seen in human life. For millions of years, evolution has relentlessly refined this process. Yet, every single birth remains unique. Every labor tells a different story, and every newborn enters the world through one of biology's greatest miracles.